Good morning, everyone. Your Excellence, Minister of Information Communication and Digital Economy of Kenya, distinguished colleagues. On behalf of the International Telecommunication Union, ITU, I would like really to express our real pleasure and gratitude for the organizers of this workshop and for Kenya for hosting this important conference. And more importantly, I would like also to highlight the fact that there has been a specific effort to bring those two sectors together. And that's why we as ITU, we are here. And we are very glad to see Her Excellency, the Minister, with you in this session. Why? Because this collaboration between the two sectors is not an option. For a long time, we have observed from ITU and WHO perspective that the health sector was trying to do it alone. And the result that it was very difficult to scale. And I'm very glad that there is now a new recognition that you cannot scale without this strong collaboration. And in that sense, I would like to suggest a new saying for digital health. Here is it. Of course, everybody knows this very famous saying, if you want to go quick, go alone. If you want to go far, go together. Okay. If you want to go quick, pilot innovations. If you want to transform, do it together and be part of the broader digital transformation in the country. I hope one day I will hear this saying by someone, so I'll be very glad. But why this is important? I can give you 20 reasons why this collaboration, why this scale-up will not happen unless there is a collaboration. From the connectivity, who will be able to connect the health centers? Definitely not the Ministry of Health. Health centers need to be part of the broadband plans. All countries, they have a broadband plans, and they have regulations and universal health service fund to connect remote areas, etc. Who will be able even to host the health applications and to manage the cloud? Most countries, they don't want to put their stuff on the public cloud. It needs to be a private cloud, a private government cloud. Who is managing this? It's not the Ministry of Health. Who will ensure the cybersecurity? It's not the Ministry of Health. Who will put all the regulations for data sharing, for data protection, for interoperability, for digital transformation? It's not the Ministry of Health. Who will incubate entrepreneurs and provide the training and maybe even providing some funding for those entrepreneurs? Definitely is not the Ministry of Health. Who will put the government into interoperability framework and enterprise architecture for the government where health should be embedded in it? And I can go on and on and on so many things that it is absolutely not possible to scale. So what I would like maybe to say very briefly, let's revisit and reimagine this collaboration. Turn the page. Please, health sector, don't even think that you can do it alone. You can innovate. You can set the standards. But for the scale, this is one of the things that the ICT sector is very good at scale. When the ICT sector deploy telecom, it's deployed for millions. And I know how to do that. And I know how to protect and regulate. So this is a message that we need to reimagine and revisit a very new way of working between the two sectors. Is not just a box to tick. No, it's much more profound than that. And we know that in many countries, there is no enough capacity within the Ministry of Health. So unless you leverage the capacities that are within the broader digital transformation, most countries now, they have smart nations plans and digital transformation plans, and there are funding for those kind of digital transformation, transition, and change. Benefit from that, be part of that. When I review many of the digital transformation, I don't, plans and broadband plans, I don't see health mentioned. This is a missed opportunity. Please, let's work together, but in a completely new way. And I'm sure that this can really take us far and really help us to transform if we do it together. Thank you.
Thank you, Hani. I think before I invite the Honorable CS, I'd just like to probably just mention who's in the room for the CS to be aware. So, Madam CS, we've This meeting has attracted people from more than 45 countries. It's a first one of its kind. And so we're really glad that we've been quite successful for the first attempt. So we have people from more than 45 countries represented here, and more than 100 organizations as well. We've had 2 tracks, Madam CS, and as mentioned before, the first track has really been mostly working with the developers and working around thinking through how can we build better digital health solutions, and mostly looking at this from a standards perspective. And as Dr. Labrik mentioned earlier, one of the standards that we are really focusing on around is FHIR, but that represents one of the many standards that this global community is thinking around. WHO also has guidelines, a set of guidelines called SMART guidelines as well. And so all this is coming together. But I think, as Hani has mentioned, we need that collaboration between health and ICT. ICT brings together the ability to scale, the ability to build infrastructure, so-called the digital public infrastructure for health. So I think with the assistance of your ministry and the influence of the road that Kenya is paving for others, we can hopefully see a lot better collaboration moving forward and be able to build and scale better solutions. So without much further ado, please join me in welcoming Dr. Margaret Ndongo, the Cabinet Secretary for ICT and Digital Economy in Kenya. Thank you.
Director General, Ministry of Health, the representative from ITU and the World Health Organization, all county government officials present, Pan-African Association of Health Informatics, HELENA representatives, Kenya Health Informatics Association members, all members of the Open Digital Health Communities, distinguished delegates, good morning. It's a real honor to be here with you, and really glad that we have over 45 countries represented in this meeting, which is great to discuss the intersection between health and technology. From my past, I worked for the AMREF, where I was part of the team that implemented the first telemedicine project. And while I was doing that between 2003, 2004, and 5, and at that point, we were using alternative technologies, VISAT, and you can imagine. And the project was cutting across Kenya, Uganda, and Tanzania. And the focus was in the remote parts of the country. And it was very clear how technology should be used to transform the health sector. We could see how doctors in the rural areas, they do not have alternative voices. If you are examining a young person, you'll be the same one with an old person, all sorts of ailments, and at that point we realize how important it is to support these health institutions with the digital solutions. So I'm really happy to see how far we have come, and really looking forward to continue interacting and working with you going forward. So it is an honor to join you at this inaugural Open Data Health Summit 2024 being held here in Nairobi. I commend the summit organizers, HELIA, KEHIA, and other partners for their collaborative efforts to equip the health technical stakeholders, software developers, and national digital architects in low, middle-income countries with the knowledge and skills that they will apply to accelerate digital health transformation in line with the Global Health Strategy 2020-2025 in their respective countries. Today's theme, accelerating full stack on fast health interoperability resources, FHIR, represents a pivotal moment for us to converge technology and healthcare, building a framework where digital innovation serves as a cornerstone of equitable, efficient, and accessible healthcare for all. Distinguished delegates, FHIR standards defines how healthcare information can be exchanged between different digital systems, regardless of how it is stored in those systems. It allows healthcare information, including clinical and administrative data, to be available securely, and to those who have had a need to access it and those who have the right to do so for the benefit of patients receiving care. Therefore, embracing the full stack approach, countries and the global community at large can unlock the full potential of FHIR and revolutionize the way they deliver healthcare services. It is my hope that as delegates and stakeholders, we will have an opportunity to explore the latest advancements in the fast healthcare interoperability resources, identify emerging trends, and thereafter work towards accelerating standards based on artificial intelligence-enabled digital transformations for health. As we engage, let's seek again familiarity with available open technologies can be used to develop FIRE resources-based digital health solutions, as well as awareness of how existing legacy digital health solutions can be supported to transition to fast health interoperability resources-based data models and repositories. I also hope that the healthcare and technology stakeholders will use this unique opportunity to progress the discussion in driving our public-private partnership based on standards such as FIRE within broader digital transformation programs that leverage digital public infrastructure to achieve the global universal healthcare goals. Distinguished delegates, as the Ministry of Information, Communications and the Digital Economy, our role in Kenya's digital healthcare transformation is grounded in creating and enabling an ecosystem that leverages technology to improve the lives of our citizens. We recognize that digital health is not merely about deploying technologies. It is about revolutionizing healthcare delivery, addressing inequities, and building resilience within our system. Through our strategic initiatives and collaborative efforts, Kenya is actively driving the digital health transformation through several key initiatives, some of which I would mention here. We have the Digital Health Act 2023, which is a landmark legislation, establishes a comprehensive framework for digital health, including data governance, interoperability standards, and the establishment of the Digital Health Agency. We have the Digital Health Superhighway, which is an initiative that aims to create nationwide digital health infrastructure, connecting healthcare facilities and enabling seamless data exchange. Just to mention that our target as a government is to connect every village, every household, to ensure that we are able to access all government services. At the moment, we have around 22,000 government services that can be accessed through the digital devices. And we'd want to ensure that in creating this inclusiveness, you can access this data, this information from wherever you are across the country. We also have electronic health records that the government is promoting the adoption of electronic health records to improve patient care, reduce paperwork, and enhance data-driven decision-making. Then we have the data sharing and interoperability framework that the Ministry of Information, Communication and Digital Economy is at planning stages to develop a comprehensive country data sharing and interoperability framework that will ensure seamless data exchange between different healthcare systems and providers as a key priority. Again, we are saying we need to have the data available. We have no luxury of when you are not well, that's when we are starting to look for your data. But again, we must ensure that our people, they are confident enough that they are sure there's privacy. Privacy will be maintained in the whole process. So we must work together to ensure that we have addressed all these loopholes. We have the data privacy and security. We have strong measures being implemented through our data commissioner and the act that was passed in 2019. By prioritizing these initiatives, among others, Kenya aims to harness the power of digital technology to improve healthcare accessibility, quality, and efficiency. Distinguished delegates, artificial intelligence integrated with standards like FIRE has the potential to address some of the most pressing challenges in healthcare. Artificial intelligence can revolutionize disease prediction, optimize resource allocation, and improve decision-making. However, its success hinges on secure and interoperability systems that allow for real-time data sharing and collaboration. And again, here, ethical issues come to play, which we must all develop to ensure that we are using artificial intelligence in a responsible way and in a way that we can be accountable. My ministry is actively supporting AI-driven initiatives, including pilot projects and on predictive analytics for epidemic surveillance and digital registry for universal healthcare. Distinguished delegates, as we delve into these discussions at this summit, let us focus on how we can collaboratively accelerate digital health adoption. I urge developers and architects to design solutions that are inclusive and scalable, innovators to prioritize the user experience, and policymakers to create frameworks that encourage innovation while safeguarding equity and privacy. Kenya stands ready to be a leader in leveraging digital health information, not just for the benefit of our citizens, but as a model for Africa and beyond. Distinguished delegates, in conclusion, the journey toward digitally enabled health ecosystem is one we must all work together. We have to collaborate. We need health experts. We need technology experts. We need ethical people. We may even need people who addresses issues to do with mental health, because again, we are saying we are all moving into the digital space. All of us must work together to ensure that we are protecting our people. We are protecting our young people to get into this digital space in a responsible way, in a productive way. And for us to be able to come up with this system we are talking about, then it is our young people who must develop these systems. As we try to create jobs, which is a challenge, not just for Kenya, but across Africa, we need to create jobs that are dignified, and the digital space provides those kind of jobs. So I call upon all of you, we work together to ensure that we are achieving this. The Ministry of Information, Communication and the Digital Economy will continue to champion initiatives that connect healthcare with the transformative potential of technology. Together, we can create a future where digital innovation fosters a healthier community and resilient health sector. Looking forward to collaborating with all of you, and I wish you all the best as you conclude your workshop. Thank you very much.